Welcome to Forefront Charity's 6th annual Gala. We're thrilled you're here tonight to celebrate our progress. It's great to be together virtually, even if we're apart physically. Tonight, we are excited to share our progress that was made possible by donors like you. With lockdowns and the pandemic, so many stepped up to make everything possible, so thank you. At Forefront Charity, we're a purpose-driven team guided by 4 values. The first is we are committed to overcoming challenges. We are striving towards a reality that champions the value of every person. Through collaboration, we tackle issues that prevent people from realizing their potentials. Number 2, we inspire hope in our communities. We help our partners in underserved areas. We encourage others to work together to create a more caring world. Number 3, we exemplify love with compassionate hearts. Love drives our mission. We serve others with our energy and skills. Our compassion for people and our heart for justice compels us to do everything possible to care for them. Number 4, we actively and intentionally steward our resources. We inspire generosity so others may help with their talents and gifts. When we unite in selflessness and thoughtful planning, we create innovative, culturally responsive solutions to serve communities. We live in uncertain and challenging times. But when situations seem hopeless, we see possibility. We collaborate with community-focused people who labor with respect, integrity, and love. We see people who are selfless, reasoned risk takers. We see people who enable their children to take initiative. We see self-aware people who use their abilities and develop their potentials. We see leaders of today and hope for tomorrow. We see change makers and we see villages without limits. Tonight, we're eager to unveil our progress on the final 2 pillars supporting our mission: medical care and empowerment. We also have special speakers lined up, so prepare for an incredible night. Thanks again for joining us in support of our mission to enable every person, equip leaders, and establish self-sustaining communities. I would now like to introduce our MC this evening. She is an experienced speaker, facilitator, researcher, and designer. She spent the majority of her career in India and West Africa, democratizing healthcare and encouraging reading among children. Above all, she is passionate about people and their stories and building relationships with others. Please welcome Brooke Kretz. Thank you, Brooke, for emceeing the night. We're so excited for what's to come. Whether our Forefront Charity team is working directly with communities in India or working from the US, we're all excited to help make change. Even as many work from overseas, we're inspired to help make a difference. Our team in India is a huge inspiration for everyone on our US team. And we're also so blessed to be listed in Forbes' Next 1,000 list this year. There is no question that the recent pandemic has brought a lot of difficulties, especially in India. At one point, there were even more than 400,000 new COVID cases each day in Andhra Pradesh, where our partners' communities are. The resulting lockdown meant restricted access to clean water because our partner communities don't have pipes directing water to their homes. Children were also unable to attend school, and there was no virtual learning options. All of us, including our partner communities and people globally, are continuing to survive and live each day the best we can. Families struggle to pay bills and send children to school. Parents want to help their children with homework and tuck them in for bed for a hopeful tomorrow wherever they live. They feel pressure to earn enough salary to afford adequate food and shelter. They want medical care so that their children are healthy and thriving. The underrepresented, including women, are fighting endlessly for opportunities to realize their dreams despite social pressures and discouragement from systems and their families. Tonight, all of us here are changing these realities for the better. We at Forefront Charity enable every person, equip leaders, and establish self-sustaining communities for the long term, local to local change. To do this, we collaborate with our partner communities to provide basic life necessities which make up our 4-pillar approach: clean water and proper sanitation, quality education, affordable medical care, and empowerment opportunities. Providing these basic rights eliminates barriers and is our vehicle to transform villages. No matter where we live, we're all connected. We share values and stories that unite us. In our hearts, we want the best for each other, our children, our communities, and our world. Tonight, we renew that investment for a better today and even better tomorrow. First, I invite Tanvi, our Director of Water and Sanitation, to share our water progress. Water is the basis of life, and clean water paves the way for education, economic empowerment, and limitless opportunities. So over to you, Tanvi.
Thank you, Matt, for that fantastic introduction to Forefront Charity's mission. Our water and sanitation pillar is the foundation of all our work. We have been continually strengthening that foundation with consistency and new innovation. Water security and access are easy to take for granted, but as you all know, people across the world are often forced to take drastic measures to supply their families with fresh water, given how crucial it is to all aspects of life. In rural India, the responsibility of collecting and carrying water typically falls on women and young girls, who can end up walking over 10 miles a day, carrying up to 15 liters or 4 gallons per trip. This is an enormous amount of energy and time that could otherwise be spent caring for children, earning an income, receiving an education, and so much more. The future looks immensely bright when you think about all the human potential free to shape the world once access to clean water is addressed. We can truly see villages without limits. Solving the issue of water access in the developing world is twofold. First is the question of where your water comes from, and second is how to ensure its cleanliness and safety to serve the needs of local communities. In the rural regions of Andhra Pradesh, where our partner communities are located, surface water in the form of streams and ponds is hard to come by. Our search for a reliable water source brings us deep underground to aquifers containing potable fresh water that can be accessed through bore wells. From our very first bore well in 2015 to the 46 bore wells we now have in 2021, we've been able to facilitate sources of clean drinking water to over 75,000 people in their own villages. So far, bore wells have served our partner communities excellently. However, our goal this year was to expand our portfolio of water solutions to improve the long-term sustainability of our efforts and to address the diverse needs of different communities facing unique challenges. We conducted extensive research to evaluate different water sources and technologies, ranging from sand filtration to reverse osmosis and hydrolysis. We created a vision for a diverse portfolio of different clean water solutions to draw from in the future as we encounter new specific challenges. In terms of sustainability, aquifers are a limited resource that are being depleted much faster than they can naturally recharge. Across southern India, many communities and small farmers are running into the issue of dried up bore wells that can no longer support domestic and agricultural activity. The search for solutions now brings us up from underground and to the sky, where monsoon clouds over this region bring large amounts of seasonal rainwater. To put it into context, the area receives the equivalent of a whole year's worth of rain in New Jersey, for example, all in under 3 months. The water from this brief period of high-intensity rain is mostly lost as runoff while arid conditions resume for the rest of the year. If we could get that water to make its way down into the aquifers, it would quickly replenish the water table and drastically increase the lifespan of a bore well. This year, that is exactly what we're doing. Forefront Charity is partnering with Sankalpa Rural Development Society, or SRDS for short, an NGO based in India that develops and implements rainwater recharge technology to revive aquifers and filter rainwater to supplement the available supply of fresh water. They have successfully recharged over 100 borewells across southern India. In September, we conducted a site visit along with the founder of SRDS at the village of Vadlamudi, where we will be piloting our very first borewell recharge system to harness rainwater. The simple design and local materials used in the construction of these units make them an appropriate solution for remote rural areas, and we are excited to see this project come to life. Furthermore, rainwater harvesting brings us closer to implementing the SN300 and similar small-scale water treatment systems, which you may remember hearing about at our Gala last year. Originally designed for surface water from streams or rivers, these solutions can be adapted to treat rainwater in our partner communities with no access to surface water. The final initiative I'd like to share today is one that is related to the incredible resilience we've seen in our communities in the face of the COVID-19 pandemic. Earlier this year, the strict lockdowns put in place across India pushed us to research single-family filtration and storage units that would minimize trips to central water sources. We were therefore delighted to investigate single-family filter units specifically designed for developing areas with a company called VivoBlue. VivoBlue was kind enough to send us sample units of their filter product, and we are really excited about its affordability, effectiveness, and simple operation. We are very much looking forward to bringing this technology to individual families to boost the resilience of our partner communities under harsh circumstances. With that, I'll hand it back over to Matt. Thank you everyone for taking time this evening to be with us and support our endeavors.
Thanks, Tanvi, for sharing how solutions such as harvesting seasonal rainwater and recharging aquifers create long-term sustainability. We're excited to begin exploring family unit filtration systems to boost the resilience of families during such hard times. Our solutions have been thoroughly researched and crafted in close collaboration with our partner communities. Our comprehensive approaches are designed to meet the needs of every villager. Tonight, thanks to your unwavering support, we are delighted to share progress in our two final pillars, medical care and empowerment. While providing clean water and quality education, we have been holding community forums and conducting interviews to continue to uncover and understanding evolving needs. We've conducted surveys to collect data on several medical issues. In one village, Jampani, we met a man who had diabetes. He's a great singer and has infectious joy. Sadly, his toe became infected. This infection spread through his legs, and eventually he had to have an amputation and then unfortunately passed away a couple months after. We were devastated to hear this news and to learn how widespread this issue is. India has the second highest diabetes cases globally and is also known as a silent killer. Our diabetes initiatives bring awareness, detection, and prevention to limit and prevent illnesses, ensuring our partner communities remain healthy. And now for our fourth pillar, empowerment, we constantly meet passionate, selfless people. Our goal is to see them shine. With access to basic life necessities, they invest in their communities to lead positive change. They are change makers. Our efforts empower change makers. In villages, they create networks to propagate change. This multiplication effect is locally impactful and self-sustaining. This is our engine for sustainable change. Altogether, with basic life necessities and change makers, communities unlock their full potential and become villages without limits. Possibilities are endless when families are healthy and children have education. With that, our Director of Empowerment, Christina, is overjoyed to introduce you to our first changemaker. Take it away, Christina.
Thank you, Matt. I'm so happy to have the opportunity to share with everyone the really exciting news that we've been working on. At Forefront Charity, our mission statement really encompasses everything that empowerment is about. We believe that sustainable development is brought about by empowering individuals to make a change by taking charge of impact initiatives within their communities. This is done by providing them with the skills, information, resources, and opportunities to make the improvements that in their own lives and within their communities. All the pillars build upon each other. Clean water and sanitation are important for all life to remain healthy and to avoid waterborne illnesses. This allows children to go to school and receive a quality education. But due to illness and the lack of medical facilities, oftentimes students, especially girls, are unable to stay in school. And girls are not as prioritized when it comes to education and are often not allowed to go to school. So we really have been working hard in the background to understand the community needs and levers by really doing a thorough research before piloting initiatives. And now we are so excited to announce 2 additional pillars, medical and empowerment. I'll share with you some of the initiatives that the empowerment team has been working on in conjunction with our other pillars. We started off by piloting and developing the Changemaker Leadership program. This program was created to identify and recruit individuals who are passionate about making a change in their communities, and by providing them with the skills, knowledge, and resources to do so, as well as the opportunities. The basic framework of this program is quite simple and involves just a few steps. The first is an identification step, where we really look to understand where help is needed. Next is the recruitment step, where we reach out to find people who are eager to make a difference in their communities, followed by an interview, and then our changemakers are provided with the tools, skills, and opportunities to see these changes through. Finally, in our evolving step, we look to help our changemakers continue to grow with consistent feedback, communication, and mentorship. To date, we have 6 changemakers that have been trained, all of whom are working on various projects and initiatives for their communities. As Matt had mentioned, diabetes is one of the most prevalent non-communicable diseases in India today. India has the second highest number of diabetic adults in the world, and 1 of 6 people are living with the disease, but many are still unaware that they have it. Since it's not only important to inform people about the disease, we also work to educate them on ways that they can help manage their diabetes through the foods that they eat and through exercise. And we really hope that this is just the first of many health workshops that we can bring to communities that may not always have the easiest access to medical information. We've been working on our first initiative, diabetes education, since the end of last year, and have faced our fair share of challenges due to the pandemic. We started off by surveying several high-priority issues such as cataracts and maternal health, and after thorough community research found that diabetes was a high priority and also prevalent across our region and country. To help educate people and raise awareness, with the help of our changemaker, Abraham, Forefront Charity hosted our first diabetes workshop in the village of Jampani. The workshop consisted of 4 sessions that took place every Saturday morning. Villagers who attended the workshop were educated on the types of diabetes and the symptoms, and their blood sugar and blood pressure were taken to understand if diet changes were necessary. Despite all the lockdowns and struggles, I'm happy to report that we've successfully completed our pilot workshops, and through the workshops, we were able to reach and educate 25 people. And as of today, we have officially launched our medical and empowerment pillars. We are now working to bring the diabetes workshops to other villages in the area. It was truly a collaborative effort with the medical team working on the educational material and the empowerment team working to recruit and train the changemaker, who then worked to set up the workshops. We really couldn't have done any of this without our passionate changemakers who are always looking to make change happen within their communities. They really inspire us to keep trying our best every single day. COVID-19 Relief was another area where we focused our efforts. Earlier this year, the second wave of COVID-19 hit India, and it was absolutely devastating. Cases reached up to 400,000 for 7 days straight, and we really wanted to be at the forefront of providing aid to our communities when they needed it the most. In addition to supplying villagers with food and masks, we also supplied sanitation workers with masks, gloves, and hand sanitizers to help them keep the common areas like bus stops and community centers safe for people. Finally, we have some really exciting upcoming initiatives that take all of our programs to the forefront. The first is a COVID-19 education and mask making program where we hire female changemakers to make reusable masks and then sell them to the communities at a cheaper price than what's currently on the market. A small portion of the cost is invested back into programs to help the community, but the rest of the cost covers material and labor costs. This way, we're able to help provide work opportunities while helping stop the spread of COVID-19. The next initiative that one of our summer interns worked on was developing an after-school girls empowerment program meant to help empower them to become future leaders through helping them understand their own potential. This program is geared towards girls ages of 9 through 12 and will include corresponding activities and lessons on topics such as body positivity, female role models, and public speaking, all led by a female changemaker. It will also include a mentorship aspect where they will meet with local college-age females and focus on personal development. As you can see, we have many initiatives to help our communities, and our changemakers are really proof that our villages are truly without limits. Their enthusiasm for bettering their communities is really what drives us to help them make the changes that they wish to see for themselves and future generations. Your support and generosity truly impact their lives for the better, so thank you so much, and now back to you, Matt.
Thank you, Christina, for your update and great job, team, on pioneering these new pillars. We've been patiently waiting to hear about our first changemaker, and it's exciting to see such a strong start with Abraham positively impacting and inspiring so many. Welcome to the team, Abraham. We're excited to build on this to multiply the impact for our partner communities. Despite geographical and cultural differences, people in our partner communities are just like us. They want the best in life and access to opportunities. For the past 6 years, we've helped improve the situation for over 90,000 people. People wake up to clean water, proper sanitation, quality education, medical care, and empowerment opportunities because of our partnership with you. Your support is essential, and we're honored and humbled by it all. Tonight, you have a choice. Your gift can have a generational impact. We invite you to join us to create a ripple effect for thousands in less fortunate communities. One star is amazing, but millions make the night sky shine beautifully. And we want to see everyone in our partner communities shine. With your support, they'll shine even brighter. We're grateful you've shared your valuable time with us. Thank you for supporting our villages without limits.